Good morning. My name is Chinasa Onyeje. I'm a DMP student from Brahman University. My title today is Let Antibiotics Guidelines Guide Your Care. Reduce bacterial resistance now. Antibiotic resistance. One of the major causes of bacterial resistance is antibiotic overprescribing, followed by other causative factors such as, patient not finishing their medication as directed, or overuse of antibiotics in animals, lack of hygiene, and poor sanitization. And the problem has a far-reaching implication because there are fewer developments of new antibiotics as shown in this graph. 1983, 1987, manufacturers were beating themselves down trying to come up with more inventions, newer antibiotics. But, as the years progress, you see how it dwindled down. By 2012, it was really, really very low, and the trend has continued. Um, Not only are we faced with the dwindling invention of new antibiotics, more than 2.8 million antibiotic resistant infections occur in the United States yearly, and more than 35,000 people die each year as a result. The cost of overprescribing is equally enormous, and here are the predictions by CDC. By 2050, antibiotic-resistant superbug created by overprescribing will kill more people than cancer. Approximately 55% of all money spent on antibiotics in the US in 2015 could be attributed to outpatient environments. Antibiotics resistance added $1,383 to the cost of treating a patient with a bacterial infection. Antibiotic resistance has estimated national cost of 2.2 billion. Um, Prior estimate was that 23,000 patients die each year. Now it has gone up to 35,000. CDC also indicate that 30% of antibiotic prescriptions are unnecessary, and the right antibiotic dose and duration are not selected for the 70% antibiotic prescribed, which are actually necessary. But they came up with a goal for all of us. And the goal is to reduce inappropriate antibiotic use by 50% in outpatient settings and 20% in inpatient settings. In light of this, I came up with my own flyer guide to prescribers and patients alike. For prescribers, it will be good to educate your patients that antibiotics do not work for virus. Um, do not bow to demands for antibiotics when they are not needed. And ask yourself if antibiotic is appropriate for a patient's symptoms. Kind of take a pause, ask yourself before you do it. Look at the guideline. Does it support your decision for antibiotics? Select the appropriate antibiotic spectrum to prescribe only when it is needed. Be sure the duration of antibiotic prescribed does not exceed guideline duration. Also, educate your patients to complete their course of antibiotics and not to use someone else's antibiotics or keep a leftover for another time of illness. To patients, the teaching would be in that antibiotics only work for bacterial infections. Antibiotics do not work for viral infection. A common cold or flu are caused by virus. You may have a sore throat and earaches and yet not have bacterial infections. And unnecessary use of antibiotic can result in bacterial resistance, making the antibiotics not work anymore for the bacteria. And a demand for antibiotics when not needed may lower your immune system actually. And prevention is key. Prevention is key. Proper hand washing, proper sanitation of your environment. And I also included the 6 smart facts about antibiotic use that I found on CDC website as well. And this is also teaching patients that even when the sputum is colored, it doesn't necessarily mean that it's a bacterial infection. some ear infection, some throat infection, and not bacterial in origin. And it goes on to explain further. So thank you. This is the end of my topic, my presentation. You have a good evening.